Welcome and thank you for having me here today. The reason for my presentation is looking at, the workers' compensation claims for psychological injury. We've been in our operation in New South Wales for 16 years and started our business in terms of workers' compensation claims for psychological injury. So I guess my talk today is looking at, three elements of the workers' compensation space for psychological injury claims, and that's in terms of treatment, looking at early intervention schemes and prevention, through prevention strategies that we've noticed. First of all, in terms of, one of the key things we've noticed in our time working in this space for people who have gone off work with a psychological injury claim is the fact that they're not receiving best practice treatment, and there's a lot of evidence that's gone into this space which has sort of shown that people who have been in the scheme for a longer period of time haven't been actually engaging in best practice psychological treatment. We certainly hear in a lot of these cases where an individual will go off work and say, well, time will help me heal in this space. I don't need psychological treatment. I don't need medication. And the evidence is certainly to the contrary. Specific goal-focused treatment where you're actually practicing skills and developing coping strategies is really key to someone's recovery if they've got a diagnosis of anxiety, depression, or even an adjustment disorder. We know that time isn't actually going to assist in resolving a psychological injury for an employee. There was a study done back in New South Wales a few years ago which looked at, the proportion of cases which were in passive treatment versus active treatment. And in that space, they found that a lot of injured workers were going to their treatment provider, being a psychologist, a counsellor, a psychotherapist, and they were sitting there having a cup of coffee, having a chat, venting, but weren't developing any coping skills. And what that showed was that they'd come home from that treatment session feeling good because they vented all their frustrations about what is happening for them in that space. But over time, over the course of that gap between their current session that they've just attended and their next session, because they weren't developing any skills in coping, their resilience and wellbeing would decline. So WorkCover New South Wales really identified the need to actually have that active treatment in place where you're having those specific goals, plans, the coping skills developed, so that when you're faced with a stressful situation, you actually know how to respond accordingly and better cope with that stressor. The world isn't going to get any less stressful. We are all faced with stressful situations. We need to be better at coping with them. And a little bit later on, I'll talk about prevention strategies. And certainly in that space, we've seen that our overall resilience compared to 15 years ago is much lower than what it used to be. And what we've noticed in that space, and the evidence is saying that because we aren't developing those coping skills again, so the way we look at a situation and therefore react, is leading to the lower levels of resilience, which therefore leads to a higher incidence of anxiety and depression. So a good treatment scheme is active in nature, and it's also according to a diagnosis, a proper diagnosis. So we often see in this space with psychological injury claims, if it's not attended to early enough in terms of a proper diagnosis, we see that people are being misdiagnosed and therefore aren't getting the accurate treatment. So having that accurate diagnosis, clinical diagnosis by a psychiatrist or a psychologist, someone who is able to provide that clear diagnosis, then a clear treatment plan can follow. And we also know in this space that there are very clear diagnostic guidelines that can show that the efficacy of treatment within the time frame. So we don't need to, if done well and if caught early, we don't need to be in a position where people are being off work for years and years and years and not actually getting and not actually recovering from a psychological injury. We know from research that if people have been off work for 12 weeks, they're more likely to be off for 26 weeks. If they're off work for 26 weeks, they're likely to be off for 52 weeks. If they're off work for 52 weeks, they're more likely to never return to work. And that's Peter Cotton's research in this space. So it's the importance of getting a good diagnosis, proper treatment, getting in early, and it gets good recovery outcomes. So you'll see from that slide that it's not necessarily it doesn't have to be long-term treatment that the person's being engaged in for their recovery. It's very resolvable and easily addressed if you're actually using the right treatment modality. So we know in the workers' compensation space that CBT, cognitive behaviour therapy, so looking at how your thoughts affect your behaviour, your thinking styles, again, affecting your behaviour, that is key to the effective treatment for psychological injury claims. So making sure that that's a part of any kind of treatment plan for an injured worker is really important. Recent research has also shown the importance of mindfulness, which is, I guess, a modern kind of form of meditation. Mindfulness is a really good way of, I guess, in a busy world, allowing our minds not to race forward, but to actually stay focused on the present and actually therefore allow our brain to slow down and recover and repair itself. So it's really good in, I guess, addressing the pace at which our brain and our thinking processes work. So the mindfulness is really key also in a recovery plan for an injured worker at this point in time as well. I just briefly wanted to turn to, I guess, the importance of early intervention. In this space, treatment is important, but it's also important to also notice what other flags are potentially impacting on a claim. So we often see, particularly with physical injury, that there are likely to be some psychosocial flags present where it could have a subsequent impact on a psychological injury occurring. So identifying the flags early, so psychosocial barriers such as, does the person have a passive approach to treatment? Are they not receiving best practice treatment? Are there people supporting them in that sick role? Are there other comorbid conditions, which are the red flags? Are there other issues going on in terms of clinical pathology? The blue flags in terms of, I guess, how the workplace is supporting them. We know from the evidence that not only is individual treatment important, but for an effective return to work, the role of the workplace in keeping people engaged and committed to returning to work is really key to an effective transition back to work occurring. Also, I guess, obviously in terms of compensation issues, the black flags, if someone is looking for a payout or is looking for, has engaged in legal advice, that is obviously going to impact on the efficacy of the treatment and the outcome of the claim. So these are the things to look out for early, because we find if we get in early and we can address those issues early, we can actually get the person recovered and return to work in a more engaged and supportive manner. And the recent changes to the New South Wales legislation, where we're focusing on capacity and re-engagement, has certainly allowed that to happen, where, well, let's not focus on, put too much emphasis on the liability aspect. Let's focus on support, getting you recovered, getting you re-engaged in the workplace and getting good outcomes in that space. As I mentioned, the other important aspect in terms of, I guess, focusing on the individual is making sure that any workplace barriers, those blue flags, are addressed. So we've often seen cases where the individual has been treated and they've recovered, but because they've said it's bullying and harassment, or there's some sort of interpersonal conflict going on, because the perception of the blue flags is still present, the workplace factors, we need to look at each individual with a workers' compensation claim for psychological injury from a holistic perspective. What are the other things that might impact on their return to work, and not just focus on the individual, treat them, get them back to work. If there are still issues in the workplace which might trigger their psychological distress, they need to be addressed as well. So looking at those blue flags are really key to that individual's recovery as well, from a workers' compensation perspective. And given that these days we see about 50% of claims coming through being in relation to perceived bullying and harassment, it may not actually be bullying and harassment. Dealing with that perception is really important to the recovery of the individual. I just wanted to quickly turn to, I guess, the prevention space, and where we've been seeing a lot of, shift in terms of workplace perception addressing mental health issues. So what we're noticing now is that people are spending a lot more time and money in the prevention space. So being able to better identify mental health issues in a workplace with an employee, being confident about having those conversations, knowing that the Work Health Safety Act is on your side in that space, and therefore getting in early before a workers' compensation claim could occur. So that early intervention is really key to building a supportive workplace where the potential for a workers' compensation claim is mitigated. There was a recent study that came out which looked at, for every dollar spent on mental health prevention and training and education, there's a $2.30 return on investment. So that's money saved in that space. And we're seeing a lot of mental health training and resilience building training being able to have those positive outcomes where the employee feels safe to actually have these conversations to say, I'm not coping, I need support, and then the employer reacting and responding without judgment so that it mitigates any kind of potential for workers' compensation occurring. So we're noticing a real benefit in that area at the moment. One of the other things we're noticing in terms of resilience, and this is where I want to end up for yourselves, is ensuring that in terms of treatment, we always talk about psychoeducation. One of the key things in terms of effective treatment is making sure that people actually follow basic strategies to monitor and maintain their well-being. And for any treatment program that we do from a psychologist's perspective, we always look at first the healthy lifestyle. So are you getting enough to drink? Are you eating healthily? Are you drinking a moderate amount of alcohol? Sorry to be a buzzkill. Are you making sure that you're having activity levels during the day? Are you making sure that you're staying connected to people? So we look at that from a diagnosis point of view. So people suffering from depression and anxiety forget the basics from a healthy lifestyle. So the resilience building piece is really important in terms of prevention to make sure that people are actually coping better and are armed with the skills when they're faced with a stressful world, as we're all faced with, knowing what the basics are to be able to be better equipped to deal with those stressors. And in that space as well, we also know about those thinking styles. If you're getting a good night's sleep, you're more rested and relaxed and able to face the day better. If you're drinking enough water, if you're actually making sure you're staying connected to people, the way you see the world is going to be different. Your thinking styles are going to be more constructive and you're able to respond to stressors better than if you're having poor sleep, poor eating habits, drinking too much. You're looking at the world in a much different space. So I guess the key message that I would like you to take away from today is to ensure that you're actually looking at, not only from, I guess, a workers' compensation space, that people are effective in terms of getting best practice treatment, making sure that their diagnosis is accurate, looking at workers' compensation claims for psychological injury from a holistic perspective, but also the importance, I guess, of early intervention strategies and wellbeing strategies to make sure that it doesn't actually lead down to that space. Thank you for your time.